last met, Jackson. I am the Vice President of Neighborhoods of Evansville. With me tonight is Katie Coons. She is our new president of United Neighborhoods of Evansville. And thank you, Katie, for taking the role tonight. I'm going to hand the mic over to Katie to keep the show going. And welcome her, please. Thank you.
Thank you so much for coming tonight. Very appreciated. We are back. It's been 14 months. This is post-COVID. We don't have any people with minutes. We don't have a lot of the things that we usually have for the general meetings. We're starting from here on. I'm very glad to be the president of UNOE this year, and I hope to do a good job. Had some excellent people over the years with UNOE who've helped me and continue to help. We did just hire Joe Bauer. He's right here. So I just wanted to say thank you for coming. Next month we are going to have the water department, and then Joe Gries also will come back and give another update. For this upcoming year, I'd like for the focus to be to get the word out to all the neighborhoods in Vanderburgh County, city and county. That's going to be a big goal of mine this year, so that we can really, everyone who lives within the boundaries of the county knows what UNOE is and that it is available to them. So we do have one order of business, updated bylaws.
And I have Pam, Brew, and Kelly are we were 3 of 5. Linda Jones and Derek West were also. So it's been a long time since February 2020. So we hope we are getting the correct information. He has pulled this up here. We made some changes, and this was in part due to, we found there were a few flaws that we needed to clarify or tweak after the election. You see in the highlighted, we changed it to 11 board of directors to 8. That would be the president, past president. You want to read those off? Yeah. President, past president.
Okay, there'll be 5 at large.
Gosh, I don't know if I can multitask.
No.
Here, I'll do you want me to?
I do, because I can't read with these glasses on. I have to change them to this glasses
Can
on.
you hear?
Okay, so we have 5 at-large voting members from the neighborhood association members, 3 senior liaisons elected by the general membership annually, and up to 4 non-voting advisory members from the community at-large appointed by the president.
Okay,
That's
but
what it's changed.
yeah, we took out the 3 senior liaisons, and we'll get to that. So it won't, we're taking those 3 out, so it went down from 11 to 8. And we'll explain why the senior liaisons wouldn't be voting. You see the definition of the senior liaisons there. They are our mentor at large board members. They represent UNOE at community events and serve as a member of the committee. So if we scroll on over, we move them from officers. They are on the board, but they would not be voting. As customary, our Evansville Police Department liaison, our Evansville Fire Department liaison do not vote. There are advisors, and typically advisors would not be voting. So we made that change. Let me turn here. Okay, and then you see where it says senior liaisons. They weren't officers, they are moved to the board of directors. Okay, where it got pretty complicated was in the next section. We just made some changes. The nominating committee. There should be 2 board members and 3 general membership representatives. Now, the nomination committee shall be where it says the final slate of the nominating committee will be the board members and officers. They shall be included in a notice in November, December, January. What happened is that inadvertently, when we had nominations for the upcoming 2020, we had people calling in after the nomination committee had presented a slate, and inadvertently it got in the newsletter, oh, if you know somebody that would like to be an officer, call in. Well, that would have been fine, but it has to go through the nomination committee. And so these people thought they could just call in and get on the slate. Now, at the membership meeting in January, when you vote, if Lucy wanted to be president and she agrees to it, somebody can nominate Lucy and she could stand up, she could be president. So see, this is, but you have to be a neighborhood representative to nominate somebody. And that's where we had a changeover of officers in some neighborhoods. So some people that made nominations were not actually representatives, and we were trying to follow the bylaws as best we could. So that's where that came about. Anything you want to add to that, girls?
No, I think you got it.
Okay, let me turn over to Brent's got it. Just very few changes. But it's always good to review your bylaws periodically. Is that it? I believe that was it. Oh, I think on one place on page 7, Brent, vacancies. This came about right when COVID hit, where it said if there's a vacancy, let's say Leonard is in at large and there was a vacancy, we said that the position shall be filled at the next general membership meeting. Sometimes that's not possible. So we say, we may not have a new candidate. So we say at a general membership meeting. So just a few little tweaks. So with that, I'll turn it back over to Katie. And Katie, somebody wants to make a motion, we accept those.
Does anyone want to make a motion on the amendments? Anybody want to make a motion?
I move we accept the proposal that.
I second.
What was your name? Okay.
What's his name?
Everybody knows who Leonard is.
Everybody knows his name.
Okay, all those in favor, say aye.
Aye.
All those who are not in favor, please say nay. It's unanimous. Okay, moving on. We now have the Senior Vice President report by Brent Jackson.
All right. Thank you, Katie. In case you don't know, we have started our Zoom meeting, and we have a stand. We're going to have an iPad. For those who wish to join our Zoom meetings, it's going to be real easy. If you have Zoom on your phone, we have a permanent ID in the Zoom world now. Is our phone number, which is 812-428-4243. At any time you want to join in to general meeting, we're going to be broadcasting in that meeting room ID number. Again, that's our phone number, 812-428-4243. It asks for a passcode right now. It's fairly simple. It's UNOE, and that'll get you in. Occasionally, as we build ourselves back up, we're going to be sending out emails and notifications again, like we once did, and we'll include links and information about our meetings in the future. All right, any questions about Zoom? Seeing none, that's all I have to report tonight. Katie, I'm gonna hand it back over to you. Larry?
We could also move into a board meeting.
Right, we haven't set it up permanently. And we might even password protect that one. I don't know yet. We really need to talk about it. Okay. We'll just skip it.
Let's skip the next subheading because I left the card in the office. Oh,
Yeah,
oh
we
my
know,
gosh.
the opposite of. I just saw the purple card.
Oh, it's not, I see it.
No, it's right there. So.
Oh, thank you, thank you.
I will mention when I was putting the agenda together, the first thing I was put on there was approval of minutes. And I talked to Linda Jones. I said, when was this last meeting? When we approved the minutes? And she said, that was in February 2020. And she kind of chuckled. And I said, I don't know that anybody will remember that meeting. She said, I don't think so.
Thank you so much. So the 2021 annual officers and board members, I'm going to go from the bottom up. Senior liaisons, Larry Samples and Lucy Williams. At-large directors, Kelly Anashby, Leonard Collins, Sarah Corrigan, Pam Rudy, Lindsay Shane. Treasurer Judy Kurth, Secretary Linda Jones, South Vice President Kathy Davidson, East Vice President Derek Russ, West Vice President Jay Triggs, Vice President Brett Jackson, and President myself, Katie Coombs. Now we have our speaker, Joe Gries, to talk about neighborhood COVID-19.
Good evening, everyone. As Kay said, my name is Joe Gries. I'm with the Vanderburgh County Health Department. I'm the administrator there. I was supposed to have a partner in crime here today, Lynn Hurd, who's one of the leaders of our COVID team. But she was working clinics early this morning, so she asked to be excused. So you've got me tonight, and I'm just going to kind of go through some data real quickly, but then I want to talk a little bit about an initiative that we're working with the mayor and Mets with that's starting up very soon. And we feel like it is exciting and something that hopefully will gain some traction and really be beneficial to a lot of people here in our Evansville community in Vanderburgh County. But the first handout that Katie's passing out just again has some data. If you don't get online a lot, watch the dashboards that the state has. There's a lot of information out there. But to date, Vanderburgh County has had over 22,000 confirmed cases of COVID-19. But currently, right now, our 7-day daily average is only 15 cases a day. So we're really doing pretty good right now. We had spring break about 3 weeks ago. We had Easter a couple weeks ago. Again, a lot of times when we see holidays like that, we tend to see an uptick. We haven't really seen that this go around. Partly, we think because of all the vaccinations that are occurring here locally, and it's really going well. And that's kind of the second section in the middle there. The population that the state is using to calculate percentages and look at vaccinations for 16 and up. So right now, the Pfizer vaccine can be given to 16-year-olds and up. We have the Moderna, that's 18 and up. But 146,000 folks in Vanderburgh County are eligible to receive the vaccine. We have over 70,000 that have received the first dose. So 70,000 people here locally in Vanderburgh County have at least some immunity to the COVID-19 virus. We have over 55,000 fully vaccinated individuals, and you can see the percentages there that match up with those numbers, so of the population. Currently, Vanderburgh County Health Department operates a COVID vaccination clinic at the Old National Events Plaza 2 days a week. We have been doing that since the beginning of February. So the last couple months here, we've been at that location, and it's been very successful. Very nice space, big area, spread out, decent parking. Got to walk a little bit across the street sometimes, but it's worked out really well. We are started working with the Evansville School Corporation and the Diocese of Evansville. As of today, we went out to 3 different high schools and vaccinated over 150 kids and staff. So that's going to continue next week, and then we'll go back the following month to get their second doses. We're also in the businesses, so we've started working with some of the large employers here locally, Berry Plastics, Anchor Industries. We're going to be at AmeriQual tomorrow. We're going to be hitting a lot of these large employers, bringing them again the vaccine to where folks work. Just another opportunity to maybe give them that resource to maybe they can't get away from work during the week to get a vaccine, or maybe they got kids stuff going on the weekend. So sometimes it's hard for everybody to just find that right time. So we want to make it as easy as we can. Starting in May, we are going to be. This is the part that I mentioned earlier, where we're working with the city and the mayor. It was a couple weeks ago, and I was telling them about some of this trend we were seeing, where we're starting to see fewer people get vaccinated over time. We know there's going to be a certain percentage that will not want the vaccine, will not take it, or maybe still want to wait until it becomes fully approved. We understand that, but we also know that people have barriers to getting the vaccine, transportation, other types of things, family issues. So we want to try to make it as easy as possible. So starting in May, we're going to every Wednesday we're going to be at Hartley Pool with the Feed Evansville group. We're going to be there with our bus from Mets, and that's going to be where we're going to vaccinate people. People can get out of their cars after they get their food, and then they can come over and get a vaccination if they so desire. We're also going to be going into the neighborhoods. Then we have, this is the calendar that we also gave everybody, and every starting again in May, Tuesday and Thursday, we're going to be at 6 different locations throughout the city of Evansville. So again, bringing that resource to people where they live, close to where they live, maybe close to where they work, make sure that they have that opportunity. Again, trying to eliminate as many barriers as possible, try to be a resource for them. If they want it, we want to be there. So that's going to continue through May and June. So we're just kicking that off here in May in a couple weeks. We're very excited about that. This has been a really great partnership also to work with Deaconess and St. Vincent. They have 7 clinics 6 or 7 days a week. Sometimes I think some of the clinics run 12 hours a day. So there's a lot of opportunity there. They've done a great job. There are also clinics for vaccination at pharmacies at Walmart, CVS, Walgreens, Meijer, and several others here in town. So there's a lot of options. But again, we want to try to find new ways and be creative in how we address this issue and continue to vaccinate as many people as possible. And if there are any neighborhood associations that want to work with us, and or has some ideas about some other locations, we are more than happy to partner with anybody and everybody to find a way to be a resource for all of us. So really excited about that, and happy at any time to come back and talk to everybody. If anybody has any questions, I'll be happy to answer questions.
We're still quarantining that coworker they also it's positive. Quarantine.
Yes. So if you are considered a close contact, unless you are 2 weeks after you've had both your shots, you're fully vaccinated, and you don't have symptoms, you do not have to quarantine. Or if you're within the 90-day period where you were diagnosed and confirmed case of COVID, so you had it within that 90 days, and again, you don't have any new symptoms, but everything else would still apply as a close contact, and you should quarantine and stay away from others. Yes, ma'am.
I really probably have a breakdown of the deaths that have occurred in the city.
Yes.
We have to go down and how many nurses and whether they were.
I don't have it with me tonight, but I do have, I believe the state has that information, and I could probably get that information for you if you'd like to see it. Yeah.
It's time to, like I say, sell those young people.
Right.
Those representatives.
Yeah.
Also, how many, you know, how many people that
Right. Yeah. I think. Yeah, I agree. I think that's good information to share. And maybe before I leave, I get your name and email address. I can try to get it out to you as well. Yeah.
Seems like eventually down the road that the supply is going to be greater than the demand. So are you doing anything aggressive to try to address, the hesitant people now?
As far as the supply.
Well, for one thing, the supply is going to get greater than the demand because people are reluctant to take it. So I just wonder what are you doing to address it?
It's a good point. And actually, if you look at like me every day, you go to the state's dashboard and you look at the all of the columns and the details on there. You can see there's a downward trend in Indiana as far as people taking the vaccine and receiving. So the numbers are trending down. It's difficult to say what the reasons are, but that's again why we need to really be creative, think outside the box, come up with these different ways, maybe to eliminate those barriers that people have, but also share a lot of the good information that's out there about these vaccines. They have helped, millions of people now in this country, and where they're less susceptible to get the virus, and even if they would, they're not going to get as sick. And that's been shown. So it's really, it's part of, educating everybody and being a resource. We want to be a resource, provide information as best we can. So we're going to continue to do that work with everybody and everybody, like I said. We have actually received some money from FEMA through Old National Defense Plaza. We're going to be putting together an ad campaign, working with the, I believe it's Reverend Arnold with the NAACP, to make sure that again, we have some resources to get messages out and share that information.
Piggybacking off of that, talked about supply getting greater than demand. So it could cause some kind of element of stockpiling. Do you see yourself, refusing any more vaccine?
We're gonna keep taking what they send us as long as we have money.
What I'm saying about it, they say you got to use it in a certain period of time.
Yeah.
So just keep stockpiling.
As long as we keep it frozen, I think that the length of time is pretty long. And we get 800 doses a week for the health department. Now the hospitals, have an allotment, and the pharmacies get some as well. And I don't know all those numbers, but right now, I think we're going to have to really start to come up with some of these creative ways now in the next few months and just like the high schools, going out to the high schools, because 16, 17-year-olds can now receive it. Doesn't mean parents will want all, some families may decide not to again. But we want to have it available so that you have that option.
Does it look like Johnson & Johnson will be back online tomorrow?
Tomorrow?
That's what the doctor said.
Okay, I haven't been following it, so you probably know better than I. Dr. Fauci or somebody has said, I knew last week they were still reviewing the cases, and hopefully those folks have got better and are in better health. But I think it was 6 cases out of almost 7 million doses of Johnson & Johnson. So if we're percentage is small, but you don't want anybody to have those issues, so.
Do you have any Johnson
We
and
do
Johnson?
not, we got rid of all of ours, yeah. We only got 300 doses, and we worked with the homeless commission, and we went out to the Vanderburgh County Jail, and then we also were doing some of the folks that were homebound. So that's what we did with ours.
No question. I look at that people list, and I know some people in the county work with hand sanitizer, and
For this ad campaign, we did not, but they're for advertising. And but I believe there are probably places and resources that we can track down for folks if they have needs. We can make sure that we reach out to other groups that have budgeted and bought those types of supplies, and we can probably provide them with those resources and make sure that they have some. Yeah, and you're right, all of those things need to be taken into account, just for this project, was just for the advertising.
Probably off the radar, but I have a son that goes to preschool, and so one of the adults there had not vaccinated, got COVID. And so, and they didn't shut the preschool down. And all the preschoolers can't get vaccinated because, and so I just wondered if there's any kind of rule on that, just making sure that adults are, their kids can't get vaccinated. They have to get the vaccine.
And there are rules for that kind of thing. The local health department does, have some responsibility there. If a person does contract COVID, there has to be a process to do the contact tracing. So if that individual, that adult, maybe wasn't around the children within a 48-hour period prior to their symptoms starting or something like that, every situation is different. The state is currently doing the contact tracing for all of Indiana, and hopefully people are sharing that information with them. If there are concerns, please don't hesitate to call the health department. We're happy to answer questions, to reach out to that facility and ask them questions and make sure that they are following the rules and they are keeping everybody safe.
I heard you say earlier about the 90 days. Somewhat safe with the fact has there been any studies on that, but it's been out past the 90 days?
Actually, the 90 days I was referring to is if you had the virus.
I've had the virus.
Yeah. So
And I've had parents who had it within my time period. But I wonder now, a year later, if there is any extension on that or still limited to 90 days.
I don't believe the CDC has put out any guidance outside of the 90 days for someone having the virus. And so if you are exposed after that 90 days, I believe you would still have to isolate to quarantine. You may still have some antibodies, but I don't believe the CDC has put out any guidance outside of that.
I haven't heard either.
I can hear you there.
I said I heard that too. That's why I thought maybe there might be some tips.
Yeah.
Because sometimes whenever a person doesn't know that they've had it, because earlier on, a lot of people were having some symptoms were just very mild, and then you go test positive again or negative, and you think you're safe. But actually, I think we should be glad to be sure that it would have the antibodies. I've had my blood test.
Getting into some areas where I need my cohort, the nurse next to me.
Okay.
There's a lot of, I'm not quite on the medical side. I know just enough to be dangerous in some
It
ways.
is very big.
Yeah, and it's complicated, but I think, and early on when this started here in Indiana, in Vanderburgh County, we had our first case on March 19th of last year. Things changed so quickly. Every week, every month, we were getting more information, new information, changed information, and it's very difficult to keep up. And they have studied this, obviously, since it started, but we rely on the local health departments. We're not pandemic experts. We rely on the federal government, the CDC, the FDA, and then state health departments to tell us, here's what we think, here's what we know, here's what you should do. And also and sharing that information with the public. So some of those questions might just have to do a little research on that. Or you could call the health department, talk to one of our nurses. They're better apt to answer those questions. Yeah, sure. That's a good question, and I don't know that anybody has the answer to that. I know. We've heard that there's a possibility that something like this may turn into a flu shot. They just don't know how long and how effective the vaccine is going to be right now, because again, it's still pretty new and they're still studying. Even the people that were in the test stages last year are still only maybe 9 months. Now, I believe Dr. Spear, our health officer, told me a couple weeks ago that Pfizer is good for at least now they know 6 months. But past that, they're going to have to study this continually over the next several years, I would imagine, before they know truly. Now, are they going to work on something where you get your flu shot and COVID shot, the same thing? Maybe. Again, getting into the medical side a little more is outside of our realm. But again, I think you just kind of watch those trusted sources of information, CDC, state health departments, and when it trickles down to us, we try to share it. But those are the sources I would rely on. I haven't heard about it. Yeah, right. Me too. Yeah. So hopefully it's similar.
Sorry, you may have already said this. The mobile clinics, is their vaccine supplied by the health department or other?
We are going to be supplying that, so it'll be Moderna vaccines.
I'm sorry.
It's Moderna. It's the health department's vaccine. We'll be supplying that.
Okay. So you guys don't carry any of the Johnson or Pfizer products?
We don't have the ability to carry Pfizer because it has to be stored at an ultra low temperature. So our freezers don't go that low. We did have Johnson & Johnson for a lot of an initial amount, but we have since gotten it into arms and we haven't gotten any more. So,
I thought the health department did have a ULT freezer.
no. Not here.
Thank you.
So, what do you think is going to be projected, the percentage? It looks like 48.1% has already received the first dose. 38.5% are fully vaccinated. As a result of these, the neighborhood, what you're going to be doing, what do you project will happen over the course of the next 4 weeks? And what do you need for us to do to help?
So, Mayor's Reopen Evansville website has all this information on it. So sharing his posts on social media would be great. Getting the word out using, I think there's this calendar actually can be downloaded and emailed to people to make sure that they know when we're going to be over the next couple months. If you know or see an area that you feel has some interest or has some need, please reach out to us. So doing those kinds of things, it's difficult to predict how things are going to be going forward. If we have a really good, if there's a lot of interest and people are showing up, these percentages are going to go up really quickly. Just to give you an example, 2 weeks ago, our 7-day average number of doses given was between 14 and 1,500 every single day through the hospitals, the health department, all the pharmacies. I looked at it today, it's about 750. So it's dropped. And again, we don't know why, we don't have specific reasons, but obviously we vaccinated 70,000 people with at least one dose. We getting to that point where we have some people that are gonna wait, may not take it, or have some barriers. So that's why, again, we're trying to be and get out to people and help them be that resource.
Speaking on that, what impact does that have with this virus? Could you speak on, people not taking it and catching it, and causing maybe the virus? Speak on, I'm asking you.
I didn't.
The relationship between the people not taking it and causing this virus to bloom or grow.
Yeah, it's like a second.
Yeah, well, we know that the vaccine is a really good tool to help prevent a person contracting the virus. It's not 100%. There's 95, 96%, I think, on Moderna and Pfizer. The more people that are vaccinated, could we have another surge? Yes, but you also have to think about all the people that have had it too. We've had over 22,000 cases over the year. So some of those have happened in the last 2-3 months, so they have some immunity as well. Again, people have always asked me during this whole last year, Joe, what's going to happen next month? How can we plan for? I wish I could predict the future. We just don't know how this is going to play out. Again, why we want to encourage and recommend to everybody as much as we can to receive this. And I think they say 70 to 75%, if we can hit that in a population, we hit that herd immunity, where you just stop seeing cases and things go away. Obviously, vaccines have been effective in eliminating a lot of diseases over the years. And it's been something that has been proven technology. So hopefully people continue to educate themselves, make the best decisions for their health and their families' health.
I've heard so many people make the argument of, why should I get vaccinated if I'm still gonna have to wear a mask? And I thought, just do it, just go get vaccinated, wear a mask. And I know when you're around a group that everybody's been vaccinated, you could sit there and not have to wear a mask. But I don't know, a lot of people are just hesitant and they think, why do it if it's not a sure thing, but yet it's something unknown. And I don't know how to convince these people.
In the masks, they're not 100%. We've seen people in the CDC guidance, even last year, if you're within 6 feet of somebody for 15 minutes or more in a 24-hour period, and one of you contracted, you become a close contact because they know it's not 100%. It definitely cuts things down. It is a tool. Social distancing obviously helps. I know everybody's tired of it. I'm kind of used to it, and I got this one from the mayor because I wear it not every day because it's so comfortable. So I might be in a different area as far as masks, but the vaccine is what we try to tell people. It's another tool. It's another weapon. This virus has, waged war on the entire world and has changed our world. So we like to use every tool in the arsenal to try to help and tamp this down and get to the other side. So that's kind of what we say.
I do know that my husband's family doctor told him that in his practice, he had not had one single case of the flu come in this year.
Right
He
there.
told Steve that just like last month.
Perfect example.
Yeah, so the masks are helping in something.
Here locally in the United States, and I'll give you a data point to kind of hit this home. In the United States, every year, 100 to 200 people, 200 children die of influenza every year. This year, as of a couple weeks ago, again, I was talking to our health officer, Dr. Spear, it's 2. 2 children have died from influenza this year in the United States. it's preventable. And wearing these masks and social distancing has helped. And that's, the hospitals last November were very worried because we were starting to see really big uptick here locally in the state. And they're worried about being overrun because here comes flu season. But all of this has helped. So it's really been something that's been, and these things may not go away because of that. You know, every flu season, we may be seeing, okay, everybody get your, protect yourself as a recommendation or, as an option.
Where I worked at, we was required to wear a mask every day because of the toxic where I worked at. So quite naturally, when the mask thing first came out, because where I worked at, if you didn't have your mask properly fitted, then they'd write you up. And so during this pandemic and the mask, and I know you've seen this and everybody's seen how the mask wasn't more proper. So you probably just getting 20% of protection. I see masks like that, wearing that. So I was very concerned about that part. They emphasized wearing masks, but they gave little attention to the perfect fit. I just wondered, did you ever decide really push that more?
We actually put some videos on our website about hand washing, about mask wearing. Sometimes you don't have all the resources you want to get the word out as much as you can. You try to do the best you can with social media and websites and things like that, but not everybody gets to see all that. And hopefully most people understood that, had some people explain things to them, whether it's at work or family or your doctor, but it did work as far as the flu. It's brought our cases of COVID down. The last 2 months we've been in the blue category. It's on the state map, and it's really kept us from having another big bump up even after the holidays, like I said.
Like right now, we going back up.
So right now we're down. Yeah, if you look at the graph, this last couple of days, it's another downward curve. So we're doing well. Yes, sir.
What's the size of your staff?
We have at the health department about 60 full-time, and with contract and part-time employees, we have about 70 staff members.
6 full-time.
60 full-time, and then with part-time and contractual, we have about 70. Yeah, we do. Been blessed. A lot of that is also grant employees. So we apply for and receive a lot of grants from the Indiana Department of Health, and we really try to augment our staff that's paid for by local property taxes with grant money as much as we can.
So what's the percentage of people of color that you have on your state?
I think it's probably around 5%.
5%.
It's not quite the level of our population.
13%.
Right. We need to do better with that. All right. Thank you all. Appreciate the opportunity.
Thank you.
Just let me know, let's say 2 months.
What's going on? I ain't done. That was my first day.
Just ignore him. Ignore him. He's horrible.
Thank you so much. Thank you so much. Just to reiterate, I was talking about predictors to lowering certain damage that this virus has caused. This upcoming month predictor and is to get the word out that they're going to be coming out vaccinating. So I'm going to definitely be doing that for my neighborhood. Next thing.
That's what I said.
Yeah. Next on the agenda is the business meeting. We have no business.
I think it's a little bit of business. Sarah has left, but we are trying to do UNOE magazine that hopefully we will be able to distribute it at the spark plug. We're hoping that we will have a spark plug dinner this fall. And we'll be able to give those magazines out. If your neighborhood has not submitted an article, please do a little write-up about your neighborhood, include a picture, and get it to the UNO office now that we've got staff there. And we'll be working on that, so.
So what's the link, for paying dues? What's the status on that now?
Okay, if we voted back last August, September, Pam, Kelly, we're right there, right around one of those dates. We voted that with this, since we couldn't have the spark plug dinner last year, and we were doing this magazine, we said that anyone who submitted their article for the magazine, that would be equivalent to them attending the spark plug and their dues paid for. So if you submitted an article, your 2021 dues are paid for. I think some dues came into the office that we might have to send back to the neighborhood that maybe they didn't understand that, but we'll.
Okay, we do have someone who wants to make an announcement.
Okay, I'm glad to be back. There's one thing I want to say, but we're having in June the 5th, we're having a block club in conjunction with 9th Street Mount Olive Galilee District Baptist Church and CCI and Neighborhood Association. Anybody that want to participate, I will get you information on it. And I just talked to Joe about having that be one of the sites for vaccinations. He said he thought that was a good idea. And I've already talked to the mayor's office and they're on board with us. And so, just another neighbor.
The newsletter.
Oh, yes.
Yeah, we're trying.
Just another neighbor.
We're
Okay,
trying.
but it's June the 5th and I'll get you some information. And it'll be an on-time newspaper, not tomorrow's issue, but the following issue. And it's open to the public. People are ready to get out and start doing something. And we're trying to have something for our area of the city also. So it's going to be from 10 in the morning to 5 in the afternoon. We're going to have a barbecue contest. And we're going to have a DJ, some bouncy houses, and some more things we got scheduled. So I just want to know about that.
Thank you.
Are there any more announcements? Anybody else have any announcements? Okay, well, that wraps up this meeting. We'll be back in 1 month. We'll to go ahead and adjourn the meeting.
Someone needs to make a motion.
Anybody want to make a motion to,
I make a motion that we adjourn.
all right?
I'll second it.